Schabert here with another quick video. This one is a very personal story. In April of 2017, I received a phone call about the first in a series of events that was going to change my life forever. My mother called describing that my dad had a set of symptoms where he was finding it difficult to control his left arm, was having a little difficulty with speech. My brother had already suggested to my mother she immediately call 911. She already had, and my dad was rushed to a local stroke center where they lived. Arriving there mere hours after the initial event, he was diagnosed with a small vessel deep brain stroke and immediately admitted to the hospital. Despite the best efforts of the medical personnel, he developed greatly worsening disability over the next several days, losing most control of his left arm and quite a bit of control of his left leg. The stroke protocol for the facility was really based on medium and large vessel strokes. And the problem with this is some of the treatment is very different to get the best outcome. The blood pressure lowering required very quickly in a small vessel stroke was not done. It led to secondary bleeds in his brain that ended up massively increasing his disability. The reason this happened wasn't because of a gross mistake by some medical personnel at the site. It was really a systemic failure. The majority of medical personnel that were taking care of stroke patients at this facility didn't know this data. I can't really get down on them too much because I was one of the more well-read primary care physicians out there at the time, and I didn't know. So what I'm calling for here, in order to avoid outcomes like my dad had, I'm down in Mazatlan right now helping take care of him because it's tough sledding after a disabling stroke. I want to see this outcome improved for everybody who seeks stroke care in the United States. And to do that, and for that and many other conditions, we just need to do a better job of getting the information that's out there to the practitioners who are taking care of these patients and see it implemented. It's not happening way too often right now in the US in the setting of stroke and many other conditions. And I want to see that change. Thank you.